FM. Assalamu alaikum to all our dear listeners. Good afternoon, hello, and welcome. We're live on DAB Station 9, live on Facebook and YouTube if you'd like to see our pretty faces. Our text number for the station is 077 488 5505. You're listening to your host, Aisha Seedat, for an hour. Welcome to my very own show, Disability Dialogues. You may have heard me on Radio Ramadan this year and last year with the amazing host, Irfan, from his Drive Time shows, or you may have seen me zooming around in the hearts of Leicester City. Having a rare disease myself called McKay syndrome, I am a rare disease disability advocate and a guest speaker of the Mumford University. And I'm honoured to have a very special guest on with me today, as I'm a patient ambassador for this organisation. So hold forward and stay tuned. Disability Dialogues refers to conversations or discussions focused around on disability-related topics. It involves engaging in open and inclusive conversations about disability, exploring different perspectives and promoting understanding and awareness. Disability Dialogues aim to break down barriers and challenge misconceptions surrounding disabilities. They provide opportunities for individuals with disabilities, their families, advocates, experts, and the wider community to share experiences, insights, and knowledge. By facilitating open and respectful conversations, these dialogues contribute to building a more inclusive society where individuals with disability can fully participate and thrive. But what is a disability, you may ask? You have a physical or mental impairment. That impairment has a substantial and long-term side adverse effect on your ability to carry out normal day-to-day activities. They can be seen and unseen. This show won't be taking any calls, but I encourage you to text in on our number 077 488 5505 for any feedback or anything you have to say for me and my guest. Now it's time to welcome our very own special guest, Dr. Lucy McKay. Dr. Lucy McKay is a UK trained doctor and the founder and CEO of Medics for Rare Diseases, M4RD. Lucy's brother suffered from a rare disease, and Lucy has spent her lifetime from early years becoming familiar with the people living with rare diseases, such as myself. Lucy studied human genetics at the University of Nottingham and then graduated from Medicine at Arts and the London School of Medicine and Dentistry, Queen's Medical University of London in 2014. Lucy McKay completed her foundation training in West Yorkshire before becoming a locum in paediatrics, and then onto that she became founder and CEO of M4RD. So welcome today, Dr. Lucy McKay. I hope you're doing well.
Hi Aisha, thank you so much for having me, and thank you to Ramadan FM for having me on today.
It's our pleasure to have you on our show today. So as I explained, Dr. Lucy McKay is the CEO and founder of Medics for Rare Diseases. The aim of our show is to bring in awareness of M4RD in the heart of Leicester and whoever's listening, whether you're a medical student or health professional. So Lucy, can you tell our guests more about Medics for Rare Diseases and why was it set up and who is it for?
Oh, well, absolutely. It's funny hearing you, Aisha, call me Dr. Lucy McKay, because we've known each other for a very long time, and I am just a Lucy to you and everyone, really. But yes, so Medics for Rare Diseases, the whole point in the charity is to teach the basic fundamental concepts and core knowledge about what it's like to live with a rare condition, in order, and we would teach that to doctors and medical students and other healthcare professionals in order to reduce the time that it takes for someone to get a diagnosis, and also to improve the patient experience. And who's it inspired by is, I guess, friends like you, Aisha, and your family. We know each other through the charity that my mother founded, and we connected through that. And I used to volunteer for the charity, and Aisha and her family would be on trips, and I was really lucky to be able to work alongside families in order to run things like conferences and family days and all sorts of activities that really connected the community of people with this rare condition, and also provided support, drove research and everything like that. So the benefit of the charity, although we talk to healthcare professionals, really what we want is for people diagnosed and with undiagnosed rare conditions and their families to feel the tangible benefit that comes when their doctors are well equipped to care for them and manage their needs regardless of their condition.
Yeah, that's right. We heard back what Lucy mentioned, that we are also friends, and I also am a patient ambassador for the M4RD, which I'm honoured to have this permission and going on for another year or so. Lucy has become, I've known her since I was almost like a child, and I've grown into my adult years, so Lucy's been there every step of the way. So, Lucy, just going back, so what motivated you to become involved in the rare disease community? As you said, your brother who had a rare disease. But what made you lead the organisation such as M4RD?
Yeah, so my position was a bit different to usual because my brother actually died sadly before I was born. So but because of the charity that my mum ran, which took a huge amount of our family's time and commitment, it meant that I was sort of always on the sidelines observing what was going on and the challenges that people faced on a day-to-day basis when they had a rare condition or a disability or complex needs. But that was my usual. But it's not unsurprising, really, I think, that I then went into medicine because I had seen the amazing things that committed healthcare professionals, doctors and nurses and all sorts of people did to try and improve the outlook for people with rare conditions. But when I went to medical school, I suddenly found that my 24 years before of this experience within the rare community just seemed to disappear, because actually within medicine, it's a lot of knowledge you've got to learn in a short period of time. And also, it can take a long time for education to catch up with what's actually happening in the 21st century. And so what I was finding was that because of the immense amount of knowledge, rare conditions are very difficult to cover, but also because of the lag in how education catches up, even though a lot has changed in the last 20 years with regards to rare and genetic conditions, the education happening for doctors hasn't really changed and doesn't reflect what's happening now. And because of my unusual circumstances growing up, it meant that I knew this when I was at medical school. And I really felt that that just because it's difficult, it doesn't mean we shouldn't be helping, we shouldn't be talking and listening and learning about rare conditions. Now, this is particularly true because although there's over 7,000 rare diseases, so that's what makes it difficult to include in a curriculum. You can't learn about 7,000 rare diseases, so how do you start? There's actually 3.5 million people in the UK living with a rare condition. So they are individually rare, but they're collectively common when you're thinking about the people and the families that are impacted by rare disease. So that's what really spurred me on to think, hang on, what can we do in medical education to make sure that regardless of prevalence, somebody can experience dignified and equitable healthcare? And that's where Medics for Rare Diseases came along.
That sounds fantastic. And the journey and story of M4RD, I think probably was there from the beginning, and seeing how far it's come, it's just been fantastic. So dear listeners, just to remind you, you're listening to me, myself, Aisha Seedat on the brand new Disability Dialogue show, and my special guest, Dr. Lucy McCay from M4ID. Off air, I got messages from my previous consultants that they were going to listen in. So if you're one of them, please text in on our number 477-488-5505. Text in your thoughts and feedback on the show. Let us know if you're listening in and what profession is. Even if I have any medical students have questions, please let us know. Tell us your occupation and where you are listening from. So going on to our next question, you've already explained about your mission and objective for M4ID. So trying to about rare diseases being rare but collectively common, so it's making that awareness to medical professions now. As a person individually myself having a rare disease, I've seen it go from in pediatrics there's a smooth transition, but by the time I got to adult, because it's so rare, it's either I'm left alone to deal with it, or they do not have that knowledge and understanding, which is quite interesting because obviously rare diseases have to be diagnosed correctly and treated in the right way. Not only that, it needs family support as well, which I think is very important as well. How prevalent are rare diseases and what are some of the challenges faced by individuals affected by the condition?
Yeah, so like I said, there's a lot of rare conditions out there. And really, the more we understand about genetics and the really detailed science behind different conditions, the more conditions there are going to be. But a rare condition is defined as one that affects fewer than 1 in 2,000. So actually, there's a lot of conditions out there that people might not think of as rare, but they are. So that would, for example, sickle cell disease, cystic fibrosis, depending on population, sometimes MS. But yeah, there are a lot of rare conditions. And so collectively, they impact 3.5 million people in the UK. So that's how many people live with a rare condition in the UK. Or globally, it's about 350 million people globally. To put that in context, it's easier to imagine the entire population of the United States of America. And so this is a really big health issue. And actually, most rare conditions, about 70% of rare conditions, start only in childhood. So these are children who are missing out if they're not being diagnosed early enough or supported appropriately. They will be missing out on formative years where families build their bonds and children learn to live in this world. They develop and grow as they need to. They get education. And instead, they can end up going back and forth in hospital or being exposed to really horrible interventions, which might be necessary to diagnose a rare condition, but not if we don't think about rare conditions. Not only are they going to be missed, but also there's going to be this problem that we see where those who have an undiagnosed condition are going on what we call a diagnostic odyssey. So a long journey that is unsupported, that often is very traumatic, with maybe unnecessary tests. If you're not thinking rare, you're going down lots of tests over a long period of time that are taking you on the wrong track. Whereas had you thought rare in the first place, you might simply have called your genetics colleagues, and that could have been an easier path and more supported. So that's really important because it has a big impact on people's mental health. If you think about what that means for families, the uncertainty that they face before the diagnosis, and then also it's rare. So often there's not that much information. You can't just walk into your local community and say, I've got this condition like eczema, and people say, Oh yes, I know that condition. It can be very isolating. So it can really impact the mental health of both the person with the condition, but also all their family. And then Aisha alluded to that actually with children, we have a general pediatrician who can look after the whole child and the family. And then what happens if someone's a child and they're living with a long-term rare condition, they then at some point get transferred to adult care, and we no longer have that general pediatrician. We don't have a general adult physician apart from our GPs, who aren't really prepared to look after people with rare conditions. So then in adulthood, you find yourself organizing your own care, and that can be a full-time job for patients and their families.
Yes, so we've got a few messages come in from a patient who's listening in. Thank you to say, by the way, incredibly proud of you, Aisha. We've got Irfan, the one who I've been on the show with, who's actually helped me. He's actually trained me. So fantastic show, really great to hear these insights, much needed. You're doing a great interview, Aisha. Okay, so I thought I was gonna go about that. I've got another question. It's from a family friend, which is quite interesting, in fact. Where do you draw the line or decide which rare conditions you look into?
Yeah, really, really good question. So rare is a number, fewer than 1 in 2,000, but we all know that that won't necessarily give us the entire picture. And actually, a lot of what rare means is actually the experience. So it doesn't necessarily mean that, so basically it comes down to lack of attention. The fewer people with a condition, the less data there is, and therefore maybe there's a lack of attention to it, or there's there's not a history of looking into this condition, and so you have less information. But actually, if you think about it, a good example of this is the COVID pandemic. At the beginning, it was a rare condition. It was affecting a small population. We didn't know much about it. There was no research into it yet because it was new. There was no treatment. Do you remember when anything could be COVID? Any symptom could be COVID. No one knew what the diagnostic criteria were. But then gradually, lots of investment was put into it, lots of time was put into it. And now we have in really record time, a huge amount of information, treatments and vaccines. So a rare condition usually hasn't gone through that process, and that isn't always due to its rarity. If we think until only in the last few years we've been having a lot of conversations about the menopause, which is something that will impact the majority of women, and that also is treated as rare. Not much attention, not much research, difficulty to get access to treatment, little awareness about it. So the answer to your question is, we don't draw the line. Medics for Rare Diseases doesn't draw the line because it's inclusive. And that's all we're ever asking for. We would simply like to see people receive equitable and dignified healthcare, regardless of the prevalence of their condition, or regardless of how much society has thought it's important to look into. And we all know that certain populations might be neglected when it comes to research and funding or certain conditions. And I think that if we can provide equitable care regardless of prevalence, we can also start addressing other social inequalities felt by different communities, whether that's due to gender, race, ability, or religion. Because if we're being inclusive in our ways, then for rare disease, then we're inclusive of all peoples. So Medics for Rare Diseases doesn't draw a line. It's more about the experience and what we can learn for the benefit of rare conditions. My colleague would say it's not always a rare condition, it's just rarely diagnosed.
That And that's very interesting what you said, and I hope that answered your question. Another question is from, assuming, a family member. So, as someone caring for someone with a rare disease, we have always faced huge barriers, not just with professionals, but with family and friends too. It has been a journey with many challenges, but we have educated ourselves to educate others to give ease to the person we care for. What would you say about that? What's your comments?
I would say, well done and thank you. And families and carers do a tremendous job and a really unseen amount of care. And while you're always going to do that, because that's what we do, we look after loved ones. What I'm hoping through Medics for Rare Diseases is we can at least lift some of that burden off you. And it can be done by the healthcare system that is meant to be providing that for you. If someone is receiving, if you can have a different condition but the same unmet needs, then that's discrimination in the NHS. So what we need to be working towards is that families are unburdened from the things that it's not their job to do, that we do have care coordinators, that you don't have to spend most of your day organising appointments, bringing together different healthcare professionals, fighting for your care, educating the NHS or healthcare professionals. And that's not to blame those within the NHS. I've worked in the NHS. I know I wasn't given the training that would have prepared me to do that. So that's why this is about, what can we do? We know this now. We've heard the voices of people living with rare conditions. What can we do to help and support them by listening to them, not deciding what we think they need, but listening? So what I would say is, anyone out there who is caring for someone with a rare condition or has a rare condition themselves, please come to Medics for Rare Diseases so that we can learn from you and pass it on in our education that we provide, because we want to make sure that what we're providing as education is relevant to what you need.
Fantastic. So you've heard what Lucy said then. How would they contact you, Lucy, if you have any family, patients, even if medical professionals get in contact with you?
Everybody welcome. It's if you email on info@m4, which is the number, rd.org, or if you Google Medics for Rare Diseases with a 4, or if you go on our website www.m4rd.org, or any of the social media platforms, and it will come back. We'll be there. I've got a lovely team who'll be really excited to hear from anyone.
Yeah, and I back what Lucy said. She's got a lovely team, and they'll be happy to support you at any time. Now, as I mentioned, whether there are any consultants are listening, and finally we've got one. This is my consultant pediatrician from when I was in pediatrics. So Jo Foster, I'm so glad you're here and listening in. She's a consultant pediatrician for metabolic disorders, and Aisha's pediatrician for many years. Aisha inspired me every day and continues to inspire me to be a better doctor. It's an important conversation for all grades of healthcare professionals to listen to. Great work, Aisha. Thank you, Dr. Foster. It means a lot coming from you. You've been part of my journey, shaped me, and have been with me in transitioning into adult care. I can almost remember the day where we were visiting Glenfield and you were there talking to the doctors, explaining my condition very well, and last words, take care of Aisha. That meant a lot for my family. Moving on a bit on what M4RD and I know they provide a lot of training support, which they've given me as a patient as well. But what's available for medical students who are interested in working in this field?
Yeah, well, I'd also like to say thank you so much for tuning in, Dr. Foster, and I'm glad that this conversation sort of resonates with you, and it's really great to have feedback from what do people working day in day out with patients, because I no longer work clinically sadly anymore, but what do you need, and how do you need to, what do you think you need to in order to receive training? Generally, we are disease agnostic, so that means we don't focus on single conditions because, as I said earlier, it would be impossible to do so. Instead, we concentrate on a message about rare diseases are individually rare but collectively common, and they come with common challenges. So a bit like with cancer, we've got an umbrella term for cancer. So most people, you could say to them, oh, do you know what cancer is? And they could have a stab, a guess at talking about it. We're trying to get there with rare disease, because actually cancer, just like rare disease, you can be born with cancer, you can die with cancer, and it can affect any person, any tissue, and that's the same with rare disease. So that's where we're trying to get to. But what we do instead is we concentrate on individuals' experiences like yours, Aisha. So we do that by working with people who are impacted by rare disease, and they tell their stories. And through telling stories, we believe that our audience learns and takes home those messages better, rather than, textbook learning of this is a metabolic condition, it's inherited on this chromosome. We want people to remember the stories and those challenges that you would talk about. And that's why ambassadors like yourself and chances like this, Aisha, are so important.
Mm-hmm. And got another question in: how can I get my primary care team or local NHS hospital to accept to contact yourself and body to educate themselves with the burden of rare conditions and support?
That's a really great question. So, sort of following on from the last one, we have a free online training module called Rare Disease 101. That's you'll find that via our website. So, Rare Disease 101. So your healthcare professionals can take that and learn the basics, but also myself and other members of the team and people with lived experience, we go out to different places and we do training in person or online. So last week I did a training for some pediatricians online and some GPs in person. So if you want to get in contact with us and suggest where training might be useful, or if you want to get in contact with us to talk about your experiences and how we can maybe support you with that, what I would also always say is patient advocacy is so important, whether you are someone supporting someone with a rare condition or living with a rare condition yourself, or if you're a healthcare professional, that anyone from anyone from medical studies to just about to retire can get in touch with a patient advocacy group, so a charity that knows about that rare condition, because they will have taken the wealth and experiences of everyone there is, which might be a few people who have that condition. They'll normally have access to the specialists, they normally have leaflets and helplines and things like that. So my advice is always to Google the name of the condition and put org UK and see what comes up. But if you're not sure, there's Genetic Alliance UK, there's Beacon, and Metabolic Support and Gene People and Medics for Rare Diseases. Come find us and we'll try and signpost you to the right direction. But yeah, anyone who's interested in suggesting training or getting in touch for training, just the same ways as I said before, through our website, etc.
That's fantastic. I vouch for being a patient advocacy. As for myself, I've been an advocate for so many years, whether that's speaking in public about my condition, or as well as speaking to health professionals on one-to-one basis, or within a conference. As part of being a patient ambassador for MBRDs, that's really helped me become an even better patient advocate. Dr. Lucy McCay has, invited me on unusual suspects of rare diseases, and we've had an array of health professionals from all over the world. So I've been able to talk about the rare disease framework the four stages, if I'm correct.
Yes.
Yeah, and which I'll get Lucy McCay to explain it a bit better than probably I can. But yeah, it is amazing, and I vouch for being a patient advocate. It's really amazing. We've got my sister here, got sent in. Hey, Lucy and Aisha, Sophia here. I'll take a moment to express my appreciation for the incredible radio show on rare diseases. The insightful discussion both had shed light on an often overlooked topic. It's a much needed conversation that can truly make a difference. Thank you for raising awareness and providing valuable information to your listeners. So thank you for that. So going back to talking about, the rare disease framework, can you explain to our listeners what it's about and what that policy is doing to help, rare diseases?
Yeah, definitely. I'd be interested to the listeners. Did you know that rare disease has been a UK health priority since 2013? We've had a rare disease strategy, and then in 2021 we've had the rare disease framework. So this is a health priority in the UK, and that goes to show a commitment from the government, which is good, but it needs more than that behind it. It needs budget. It needs people to be listening to what the people who have rare diseases really need, and learning from places where we've done this really well, like for example in cancer. But the rare disease framework has 4 priorities to it. So number 1 is getting a diagnosis faster. Now, personally, I would phrase that as having a timely and supported diagnosis. Faster isn't always better. If a diagnosis is going to be quite devastating, then that needs to be prepared and supported. Otherwise, it can be a really fraught time anyway, and then it can be made worse. The second one is about healthcare professional awareness. So that's where we come in. Again, I personally wouldn't put the pressure on the individual healthcare professionals out there who are all working in an amazing way, working very hard. But actually, it needs to come from the top. We need training. The NHS needs to, mention rare disease on its website. So does NICE. You need to be able. Healthcare professionals need to go to their trusted resources and find stuff about rare disease as an area. Otherwise, how are they supposed to individually all know what to do? But that's where we come in, and we're helping with that kind of thing. So the third priority is coordination of care, which I mentioned earlier, and so did our listener, about how the coordination of someone's care, particularly in adult services, when they have a multi-system, so lots of different body parts affected, condition that changes and is complex over time, that care needs coordinating, again, like you would get with a Macmillan nurse if you had a cancer. And then the fourth one is access to specialist care and access to treatment. So access to specialist care, when there aren't many people with a condition, they might all go see a certain specialist. That person might be across the country. They might be in a different nation, Wales and England. So accessing specialist care can be really difficult, particularly if you don't have the funds, or the expenses to be able to pay for that, or you have a disability, or other barriers that get into the way. Access to treatment, people always often think of that as because drugs for small population numbers are very expensive often, but it's even just some people don't have any research in their condition, haven't for a long time, or some people have to pay every time for a prescription when a different rare disease classification doesn't. So it can be as simple as things like that. So we're part way through the framework, and there is a lot of work going on it, and I think it shows promise. We just need to keep making sure that we're asking for the right things, that what people are expressing they need.
Fantastic. We've got a few more messages come in from Hafley Randomness Conet. I've said that correctly. Thanks, Aisha. Advice is always useful. I've been living with chronic pain for many years. recently got diagnosed with a couple of rare conditions and find there's a lack of knowledge and support. Training in the health service is definitely needed. Thank you for having these conversations. Really has inspired me to ink the book with my changes and story. Thank you, Lucy. Would love to get in touch as a patient and get advice in order to make this journey smoother and give hope to the next person diagnosed with a rare disease. And the next one's from my mum. I can see that superb awareness raised in this topic of rare diseases. Lucy's passion in this area comes with great expertise. I've got a message from a relation. From mine, Salams Aisha, loving the show. You truly are an inspiration and keep up the amazing work. As an MS warrior, the show and Dr. Lucy are really informative. Thanks for bringing this to us. Lots of love. Got a question. So, what are some common misconceptions surrounding rare diseases, and how can we work together to raise awareness and support for individuals affected by them, which I think you've covered it?
If you don't mind me just saying on that one, Aisha, I think the a few that maybe we haven't covered, apart from the fact that they're not that rare, but you should be expecting. So it's estimated as 1 in 17 people will be affected by a rare condition in their lifetime. I think the other thing is a lot of rare conditions are invisible. You know, that you can't tell that someone is living with a rare condition. As I said, a lot of them start in childhood, but so that means that there's a lot of young people out there going through life that you normally have to go through, that's quite difficult when you're a young person, with an invisible condition and a rare condition, possibly with a lot of symptoms. And yet I don't think you ever get to see that in society. We might think of children with disabilities, we might think of elderly people with disabilities, but not anything in between, especially if then the whole, not all disability is visible. So I think that's really important to keep in mind. The other misconception is that there's nothing you can do. That's what we hear a lot. There's nothing you can do for rare disease. The last 20 years has shown us in the treatments that have been made, that's not true. There's nothing you can do if you don't want to do anything. So where there's a will, there's a way. We saw that with COVID.
Absolutely. And last question from one of our listeners. What record do you have if your medical team give up on you? I was there and I had to self-advocate. Makes me think, what about those who can't self-advocate?
I think that's exactly where Medics for Rare Diseases is coming from. I'm really sorry that this has happened to you. I would always try, if you can, to go to a patient advocacy group, because they might have more resources and more information. And it might be that that team, they're completely out of resources and out of information, and maybe there's a way to bring this back together. If you've got, say, a patient advocacy group or another advocate who can help you through that dialogue and that conversation. I hope that when I retire from doing this, this will no longer be the case, because healthcare professionals will have been equipped. You know, they haven't been equipped, and they don't have the resources. So hopefully that will be a thing of the past when I've given up and I've gone off to retire.
And there's a question from a listener, which is quite interesting and something I've faced on a personal basis in my last few admissions. What do you do when your consultant says there's nothing more we can do?
Yeah, I mean, it's hard to say. I can't speak specifically because I don't know about your situation, but I think nothing more we can do is a very big statement, and different people understand different things from that statement. So I think what's really important is that if you can, it's about making sure you can have get another chance to have that open dialogue and find out exactly what that means. And again, I would always take go for get some advocacy, get them to support you, to know what questions you should be asking, and find out what that means to them, what that means to you, and that you've had your wishes and your needs expressed, and heard, and then go from there.
Absolutely. What Dr. McCay said, and that's something that I've faced as a patient on my own, with my family around now. When I'm very ill, I can't talk, I can't speak, I can't move. So it's occasionally them either talking at me whilst I'm like, I don't know what's going on, or my parents are in the room and they just overlook my parents and they just think I'm going to suddenly say something. So it's quite good to have a wishes plan in place, so you know something to state that if I'm unable to speak to this person can speak on behalf of me. We've got 4 minutes on the clock, so we'll sort of wrap up. But I wanted to know from yourself, so what does the future hold for rare diseases?
Oh, well, I'm an optimist about this, because having always been involved in rare disease, how far we've come is amazing. Even from when I started doing this work when I was a medical student, like 10 years ago, the fact that we're even having this conversation is really amazing. The fact that there's clinicians who are listening, asking for this training, and there's families and patients who are joining up with them. I think what we're seeing is really positive. So I think, progress, I think about President Obama said this, that, you're always going to have ups and downs, but progress is always happening. So I think the future holds hopefully better experiences for patients and their loved ones and their carers.
Fantastic. What would your last message be in 10 seconds and one line, if you can do it, Lucy? To our medical students are listening in, or maybe starting their journey to understand this field more, not just medical students, but already health professionals, to help them go forward.
Easy. Treat the patient, not the disease, and then you'll be looking after them. And also #dare to think rare.
And that's my favourite hashtag, dare to think rare. Probably see me say that half the time. And exactly, treat the patient, not the disease. It's always about the patient. So thank you, Dr. Lucy McCay, for blessing us with your presence and wisdom on our show. If you'd like to contact Lucy, please feel free by emailing in on info@m4rd.org. You can head over to their website, m4rd.org, to find out about the training and programs available. Don't forget that you can reach out. And that's all we have for today. I hope you enjoyed our show. I'm so honoured to have Dr. Lucy McCay here blessing us on my first show with the launch of Disability Dialogues. And hopefully maybe in the future you might see us once again on here. But don't hold back. Please tune back in on the 23rd of July at 3 p.m. with a friend and colleague of mine, Julian Harrison, who'll be telling us about his brother who sadly passed away, who had Down syndrome. This is an interesting story to share, and if you know of anyone who has Down syndrome, who cares for someone with Down syndrome, or wants to know more about the condition as a health professional again, please let them know and stay tuned in. You can stay in contact on my socials on Instagram, IAMIS page, or stay tuned on Radio Ramadan's Instagram, Facebook, Twitter for when my show next goes live. Thank you again for tuning in, and I hope you all have a good Sunday. Thank you for taking time out. Thank you again, Dr. Lucy McCay, for taking your time out. I know you have such a busy schedule, and I know, and I'm eager and can't wait to meet you next week for our Ambassador Learn and Lunch event.
Yeah, we'll see you in London, Aisha.
Definitely. So thank you, everyone else, and hopefully we'll see you back on the 23rd of July with Julian Harrison talking about Down syndrome. And that's all from me today. Thank you.
Bye. Thanks so much.